Dr. Gabi, you referred to Cushings. What is that?
Cushings in horses.
Oh,
it's called Equine Cushings. And it's actually defined in the Merck Veterinary Manual what Cushings is. And it's named after, I believe, a person originally. But it's a disease in horses. It can show up in dogs too and in humans. And in horses, it is defined originally as a brain tumor. And the tumor sits in a specific area of the brain, which is called pituitary. And the pituitary is a gland or hormonal gland in the brain. And over the course of time, and this is where I still get stuck, I don't really exactly know what happened, but all of a sudden, within the recent years, the incidence of Cushings have skyrocketed, especially in the United States. And somewhere along the way, it was renamed. It's not called Cushings anymore. It's now called PPID, which stands for Pars Pituitary Intermediate Dysfunction. So the pars means Latin is a part of the pituitary. And what kind of part are we talking about? There's three different parts. We're talking about the intermediate part, which is in the middle between one and the other part. So this all is an anatomical description. And the word that I pound on is called, it's D, PPID for dysfunction. Now we have renamed this Cushings disease, originally identified as a tumor, into a dysfunction. And that all of a sudden opened a new realm of possibilities, because a tumor, we know what a tumor does. A tumor is totally isolated from the rest of the body. A tumor has certain characteristics, means a tumor will proliferate, it will grow, it will not listen, and that's one of the most significant characteristics of a tumor is it will not listen to the rest of the body. So usually the pituitary will receive feedback from mostly the adrenal glands and the thyroid about what to do and what not to do. So it sends out messenger hormones, and they go to the adrenals and they go to the thyroid. And when the adrenals respond and they do what the pituitary wanted them to do, they will send the response hormone, in case of the adrenals, it's cortisol, back via the bloodstream to the brain, to the pituitary, so the pituitary can release and lower the message hormone, which is called ACTH. And the tumor would not react to this. A tumor will not obey this feedback mechanism. A tumor will not listen. But in a dysfunction, we are assuming that it's the same behavior as in a tumor, but it is really not. So what I'm trying to say is that since we relabeled it into a dysfunction, the diagnostics around this have become rather vague, and because there are several diagnostic tools out there, and some of them are put the horse at risk. For instance, the one significant test would be this called DEX suppression test, which puts the horse from a conservative view into a health risk. So most veterinarians have retreated into just determining the level of the instructional hormone, the ACTH, that goes out to the adrenals. So the pituitary in times of stress will elevate the ACTH levels. When there's stress coming from the outside, ACTH levels go up, and then it will instruct the adrenals to increase cortisol. Now, as soon as the ACTH level is increased, the cortisol level is supposed to go up, and the feedback mechanism should bring the ACTH down again. But in most cases, the ACTH gets measured once, and if it's elevated, then the horse is diagnosed with Cushings. And there was a webinar or something from some online horse magazine, and the person said, I forgot the name, said, yeah, we project that in a couple of years or 3 years, every third horse over the age of, was it 10 or 12, is going to be diagnosed with Cushings. With the brain tumor? Really?
That seems kind of...
So it seems kind of out there. So what we have to do is we have to be more critical. And what I find is, and I've done this now numerous times, and I have data for this, that we can actually naturally, with certain nutritional management and nutrition and management, lower those ACTH levels naturally. and we do not need the medication to force those ACTH levels down. We can take out the underlying issues that stress the horse out, and sometimes it's just plainly aging. So some people said, well, I'm anti-aging my horse. You can call it this way. I just call it a normal physiological reaction from the body. We remove the stress factors and we encourage the hormonal balance in the pituitary and the adrenals, and we enable the pituitary to lower those ACTH levels in that gland naturally. So do I cure Cushing's? No, I don't. I would say that the modern Cushing's PPID, the horse owner with our guidance can influence in such way that the ACTH levels drop. Now remember, if it was a tumor, this would not be possible. We could not lower ACTH levels that are brought up by a tumor, because that tumor will not listen. But since we are encouraging this tissue in the brain to listen and the tissue does react, it cannot be a tumor. Is it still a dysfunction? No, because it's functioning normally in response to the rest. So what is it then really? And I'm going to leave this up to you to ponder more about that.